All right, everybody, thank you so much for joining us. My name is Devin Desjarlais. I am Director of Marketing and Storytelling at United Way of the Greater Triangle. I have with me Melanie Rankin, who is the Development Director at Alliance Medical Ministry. For those of you who are not aware, United Way of the Greater Triangle funds 85 nonprofit partners across 4 counties. So you've got Wake, Durham, Orange, and Johnston County. We fund partners under specific focus areas, including healthcare, education, workforce development, and more. Melanie represents Alliance Medical Ministry, like I mentioned. Their commitment is to providing quality and affordable healthcare to working uninsured adults in Wake County. They do incredible work. She's here today to tell you a little bit about what her organization does, their commitment to the community, the types of programs they have, how volunteers can get involved, but also how they've pivoted during COVID-19. We all know, judging by the fact that you're on this link and we're not standing in person, that everything has changed in the face of this pandemic. Not just how we meet, but how we serve, the needs that are represented, the amount of people who now have needs where they didn't before. And so Melanie's team has done an incredible job of pivoting to ensure that the folks that they support experience no gap in healthcare needs covered since the beginning of the pandemic. So Melanie, thank you and welcome. Welcome and thank you for joining us.
Thank you for having me.
Can you tell us a little bit about your organization, about Alliance Medical Ministry, its mission, and maybe some of its history?
Sure. So Alliance does, we are a full clinic that has primary health care and mental health care. We've been around since 2003, and we serve working uninsured adults in Wake County. And a lot of people don't understand what that means. People think all people who work have insurance, but most of our patients work multiple jobs, part-time jobs. They don't receive health insurance from their employer. They don't qualify for government, Medicaid, or Medicare, and they can't afford private insurance. And so it's a huge gap. There are around 117,000 working adults in Wake County that don't have health insurance. So that's who we're serving. We're located very close to Wake Med Hospital, and the majority of our patients are actually referred by Wake Med and Rex and Duke Raleigh hospitals.
Thank you for sharing that. That is incredibly helpful. What I have pulled up for everybody right now, Melanie has pulled together some photos to really give you guys a feel of Alliance Medical Ministry. It's more than a place where people go for support with their healthcare. It is a community-based center. And so, Melanie, can you tell us a little bit about what we're looking at right here?
So yeah, this is Alliance. Our building actually used to be a church. And so if you can imagine, the upstairs where all the probably Sunday school classrooms have now been turned into examination rooms, and it's really set up in pods. So we have 3 pods, and our clinic staff works as a team. So the same team of doctors and nurses work together so that they build a relationship with our patients, and the patients see the same clinic staff and they get familiar with each other and build trust. I think that's one of the things that make us unique, that we work in clinic teams. And then the downstairs has our lobby and check-in offices and a full kitchen, which is where, and we'll get more into more details, we have our wellness classes, Cooking Matters, and yoga and Zumba. But we also have a full garden on site. It's a beautiful garden right now. It's full of every vegetable you can think of, summer vegetable, from squash and tomatoes and peppers and okra and eggplant and zucchini. And we teach our patients how to cook and eat healthy using the garden, but also when patients come to on site for a visit, they get to receive a bag of whatever was harvested that morning.
That's amazing. Thank you so much. So I'm going to go to the next slide here. Can you tell me, what is unique about Alliance Medical Ministries' mission? Like, what is something that the average person doesn't know about what you guys do?
Probably that we have a holistic approach. We believe in treating the whole body, body, mind, and spirit. And we have a behavioral and pastoral counseling department. And we have a full-time psychologist and a full-time social worker as part of that behavioral department. And as most people know, mental health is a huge need right now, and there's not many options people who don't have insurance to go to for mental health. And so part of our holistic approach is also to empower our patients to learn how to manage their chronic diseases, which is through healthy eating, exercise, and diabetes education. And we offer all of those classes as part of our program. You'll see a photo. When there's not COVID, we have Zumba here every Thursday night. We have yoga here every Monday night. And diabetes classes are on Saturdays. And Cooking Matters are 8 weeks out of the year.
That's fantastic. So we do have Toshiba Rice, who has joined us. I know she's having a little bit of trouble connecting to audio. Toshiba, if you can hear us, let me know. So Toshiba is a former client of Alliance Medical Ministry, and she also is the founder of, and I apologize, I feel like I'm going to butcher this pronunciation, but Joki Enterprise, which is a nonprofit dedicated to helping to support families and communities that are impacted by mental health, substance abuse, and adverse childhood experiences. So we have her here to tell her story and share a little bit about her experience, not just with Alliance Medical Ministry, but her journey to becoming a nonprofit co-founder, and what her goals are with her organization. Toshiba, can you hear us?
I can now.
Hello, hello, welcome.
Oh, yes, thank you. I guess I came in right on time. Was having a little bit of technical difficulties.
We're glad you're here.
Yes, thank you so much. So you wanted me to share my story?
Please do, and tell us about you. Tell us about your experience with Alliance Medical Ministry. Tell us about your nonprofit.
Oh, okay. So I just wrote out a little something here just to share a little bit. So just greetings, everyone. I'm Toshiba Rice, and I want to share my Alliance Medical, I'll share why Alliance Medical Ministry is a necessary and an amazing medical organization that helped save my life. So over a half decade ago, I was introduced to Alliance Medical Ministry services and was treated for my physical health conditions of like hypertension, obesity, and asthma. When I was introduced to Alliance, I performed multiple roles in my community and home. I was an education and mental health activist, local government committee chair, small business consultant, a faith leader, and caregiver that assertively advocated within schools and mental health facilities for my family's well-being. Over the years, when visiting Alliance Medical Ministry services, I noticed signs about pastoral counseling, but stayed focused on my health needs and participated in engaging physical health programs offered through Alliance like 1 Million Steps and Walk with a Doctor and Cooking Matters and other programs. One morning before my routine follow-up, I was struggling emotionally as trying to keep myself together with this part, guys. I was struggling emotionally as I had been for several months and felt I needed help. Through my silent tears in the shower where my family could not hear, I sobbed and I felt spiritual comfort when a thought resonated inside of me, telling me that a pill and a prayer is okay. I decided that morning that during my visit, I would tell Dr. Joyner that I needed help. It didn't matter. I was training others in mental health first aid across the country. I now needed to use the very skills I shared with others to stay safe and well. During the end of my visit, Dr. Joyner asked, was there anything else I needed? I nervously shared with her how I was overwhelmed by being a caregiver of 4 children and a husband, working in community, and at times had thoughts of completing suicide. The overwhelming pressure of supporting twin sons living with oppositional defiant disorder, attention deficit disorder, as well as a husband living with bipolar disorder and schizoaffective disorder. I felt as if I could not go on living like this with no one to even share my inner thoughts. Dr. Joyner showed me empathy and no judgment. She wrote me a prescription after a series of questions with a promise to contact her in 5 days. But her next statement changed everything and saved my life. Don't go anywhere, she said. I have someone I want you to meet today. She said, you will love Toby. He is our director of pastoral counseling, and I want you to speak to him before you leave. Oh, how the day, it changed my life, guys, for the better. I met with Toby at 8 a.m. Monday, every Monday for 10 months. Toby is an amazing professional. He focused on results that were driven, that allowed me to really receive great health services. He never once made me feel like he wasn't listening. He always asked the right questions that made me teasingly want to throw tissues at him during sessions. So that inaugural day was my exodus, and that newfound clarity of thinking allowed me to use sound judgment in making decisions that were best for my physical health, my mental health. For me, Toshiba, I could now begin to work more productively with helping provide my family, to be able to fuel the economy by becoming more financially stable and help others with my purpose. And this new outlook changed the structure of my business model that launched the I'm Well Network. It means I'm wholeheartedly enjoying living life. So individuals and businesses and institutions can strategically invest in self-care and human capital for healthy and prosperous lifestyles. This network allows members to set wellness priorities, choose a wellness track, and complete wellness sessions for their exodus transitions of not well, becoming well, and the end result of saying, I'm wholeheartedly enjoying living life. I'm well. That is what Alliance Medical Ministry did for me so that I can say that I'm well. I just thank you guys for allowing me to share why Alliance Medical Ministry literally saved my life.
That was.
Oh my gosh, Toshiba.
I don't know about everybody else, but.
I try not to cry. And Melanie knows that I cry.
That made me cry.
When I tell this story, and I wanted to stay on subject and message because Alliance was just not a facility that's there just to service folks. It was a facility that actively listened and at patients' needs and what was best for them at that moment. And because of that, it transformed everything that I'm currently doing and embracing, and it helped me manage my life, my health. I'm constantly moving toward becoming well in my physical health. And so Alliance embraced me with these skills and empowered me, and I'm continuing to working on that. And I promise you, I am wholeheartedly enjoying living life, guys. I am well. I'm well.
That makes me
Thanks
so
for
happy.
letting me share.
I am so inspired. And, I think you touched on something that is incredible. 2 things, many things that are important, but 2 things in particular I want to bring up. One is, physical health is an apparent need. People understand when they see a physical health need, why it needs to be addressed, but mental health is not visible. And it is a very important part of the holistic healthcare approach. But not only that, you pointed out through your own story that Alliance Medical Ministry is there to help on a day-to-day basis, but they're also providing the vehicle to empower folks to follow their dreams, giving you the support and the stability so that you don't have to worry about that anymore. And you can go and you can follow your dreams and you can start your foundation and you can start these programs and you can pass it on. And I think that is so incredible. It's an incredible part of the story that people don't often get to hear.
Thank you for allowing me to share. I greatly appreciate it.
Thank you.
Shiva, I love you. Thank you.
I love you more.
Well, Toshiba, I'm honored to meet you. I hope, if you need to go, we totally understand.
Oh no, I'm here for the
around.
long haul. I
it.
fixed my schedule to be here and support of the great things United Way has done over the years. I'm aware of other programming and seeing this today about health. It is something that's near and dear to my heart, as my company does the same. And so I wholeheartedly support what you guys are doing. And someone needs to share, and I'm thankful that I have the opportunity to be that someone.
Thank you, Toshiba. Thank you. So Melanie, let's shift for a second and talk about the elephant in the room, the pandemic.
Huh?
I say that with a laugh because we've all been living in this for 4 or 5 months, 5 years at this point. It feels like it's changed everything. It's changed not just our community, not just our individual experience, but our global community, our global experience. It's aligned people and united people in ways that I never expected, but it's also been divisive. It's shown us where the gaps are in equity. And I happen to know the background on Alliance Medical Ministries Pivot, but I've been so inspired by how innovative and how quickly you guys worked. And so I was wondering if you could tell us a little bit more about how you've seen needs increase during COVID-19 so far, and how, if you can explain, how your organization pivoted and shifted to meet that need.
Yeah, so, it just so happens last fall, we started looking into telehealth long before we knew anything about COVID coming. We just started looking at it and started training staff and getting familiar with it and thinking it would be a good thing for our patients, because our patients have barriers just getting here for help, transportation needs, childcare needs, can't leave their job. So we started looking at telehealth last fall, and when COVID-19 happened, we were able to very quickly pivot and go 100% telehealth. And so telehealth is a pretty sophisticated system in which a doctor can see the patient and talk to the patient, but at the same time, you see that picture with Dr. Joyner, she has another screen that has the patient's medical records and can make notes and read their medical records all at the same time. And so along with the telehealth, we started a medication drive-through pickup that you see there. We dispense about $350,000 worth of medications each month. And a lot of it is life-saving medications such as insulin. So we knew our patients couldn't go a day without their medications, but didn't want to come in the building. So we started a drive-through. We also started a drive-through lab testing. So if someone needed to have their blood sugar levels tested or their heart blood pressure tested, we would go outside and do their blood pressure monitoring or a blood test. So we pivoted quickly, and we didn't miss a single day of serving all of our patients.
That is absolutely incredible.
So
go ahead.
I'll add to that, what we have seen with COVID, that when a patient has either symptoms or confirmed case or exposure, it is taking almost 2 to 3 more appointments than usual with a patient, because they have to be monitored so closely, because most of our patients already have conditions that getting COVID would cause even more severe complications. And so we do spending a lot of time monitoring patients now. We have seen a huge increase in mental health sessions. They have gone up by 35% since COVID outbreak. But we've been able to do it through telehealth. It's not quite the same thing, Toshiba, as one-on-one, but still you can see Toby and he can see you. And then our primary appointments have increased by 15%.
And is that increase from new patients, or is that just, due to the contracting COVID or still dealing with other healthcare needs from
A
current
little
patients?
bit of both. It's mainly our current patients, but we take referrals from our partners in Wake Med, so it's a little bit of both.
Gotcha. Thank you. One of United Way's goal this campaign season is to fundraise for community stabilization and recovery, because we're currently in this pandemic, right? We've seen the effects, but we know as a community that we're not nearly done seeing the effects. And at the end of all of this, when life goes, quote unquote, back to normal, there are going to be even more people than ever before who need support to make sure they stay on their feet, who need support to make sure that they can get jobs back, that they can get their healthcare needs addressed, that they can, they don't fall through the cracks. This is an unprecedented scenario. And with United Way donor support, we know that we can help address that when it comes. And so I wanted to ask you, what role do you envision that Alliance Medical Ministry will help to play in the community when it comes to stabilization and recovery after COVID-19? And how do United Way's year-round funds support you guys in those efforts?
Well, before COVID, we had a patient wait list of 500 people. And now with people losing jobs and losing their health insurance, we know that the demand for our clinic is going to increase. And so we had already planned a campaign to build capacity before COVID because of that wait list. That campaign was paused, but now we're relaunching it this fall. But the whole purpose is to raise funds so that we can hire another full-time doctor, another full-time bilingual mental health counselor, and other staff and medical supplies to support that team. We have the space. So we already knew this was a need before COVID, and now it's just heightened and kind of accelerated. So funding is really important, and year-round funding is most important because that supports our budget, which supports all of the important things we do. Doctor salaries, nurses' salaries, medical supplies, the medications, even something like the electricity in our building. Well, that's what keeps the insulin cold in our refrigerator, and that's life-saving for our patients. So, reliable funding year-round, we couldn't do what we do without partners like United Way.
Thank you.
And I have to add, United Way has been unbelievable since COVID. I mean, they also quickly pivoted, and y'all were one of the first earliest gifts. You raised the funds quickly, and then you quickly got it in the hands of those organizations that were providing really needed services right away. And that funding was important to make sure that organizations didn't shut down, and y'all were really quick.
For anybody who's not aware, the fund that Melanie is referencing is the Rapid Response Fund that we launched on March 16th directly to support nonprofits who were meeting an increase in critical needs throughout the pandemic. And so you guys have been incredible supporters. We have been able to distribute an incredible amount of funds in just a short amount of time, and that is credit to the generosity of the community, to the nonprofits that are doing the work, who helped us identify where the need was. And we're grateful, so grateful to everybody who's going to continue to help us meet this need of recovery and stabilization following the pandemic, because that is going to be absolutely crucial. Melanie, I have one more question for you before I want to open it up for Q&A. If anybody does have a question that you're thinking of, you don't want to forget, feel free to drop it in the chat box to everybody. I will be looking at that after I close the PowerPoint. So feel free to drop it in there now whenever you think about it. I apologize, I meant to show that picture before.
That's one of our nurses, that's James. And so we are seeing patients in clinic, a very small amount of patients in person. But as you can see, our protocols and processes have completely changed, and wearing masks and only letting one patient in at a time is part of that.
Gotcha. So the last question I have for you, in campaign season, in-person volunteering is always crucial to support the organizations, but also it gives our donors the chance to see firsthand the incredible work that our partners do on a day-to-day basis. And so with COVID-19 and social distancing best practices, United Way has made a commitment to supporting volunteer opportunities 100% virtually, at least through the end of the calendar year, to ensure everybody's safety. And so with that, though, we want to make sure that we're giving not just our nonprofit partners the opportunity to seek virtual support, but that we're giving donors the opportunity to help out as they're able to. And so I was wondering if you could tell me really quickly how volunteers can best support Alliance Medical Ministry right now, and what does a volunteer opportunity look like for you guys specifically?
So we still can safely take small groups like 10 and under to work in our garden, because we can spread people out and it's outside. And we have volunteer groups that come pretty regularly and help us in our garden. Our garden's more important than ever because we're finding more and more of our patients are having food insecurity issues. So anyone who wants to bring a group of 5, 6 people and work outside in the garden for a half a day or a full day, we'd love to have you. And then if you don't want to come to the site, building our hygiene kits that you could do at home or with a group or at an office is always helpful. You'll see on the screen the dental hygiene kits, the flu kits, and we also have feminine hygiene kits. We give those out to our patients when they come to visit, along with the vegetables from the garden. So if they come for a medication drive-through pickup or any kind of drive-through testing, if they come in to do paperwork, or if they actually come in to see the doctor, we just give these kits to our patients. And right now we're completely out of all of them.
Thank you. If people did want to get in touch with you about any sort of on-site volunteering, how do they reach you guys?
And on the screen, I think it's on there, you'll see Ruthie Wofford's email.
Right on.
Or Wofford at alliancemedicalministry.org. She organizes all of volunteers, and they can also contact me, and that's M. Rankin at alliancemedicalministry.org.
Wonderful. Thank you. I'm going to go ahead and end the slideshow and stop sharing just so I can see any questions. But this is the moment, if anybody has any questions for United Way, for Melanie, for Toshiba, please don't hesitate to either turn on your mic and speak up or drop it in the chat. But also don't feel like you have to. It's not a class participation requirement. So we've got a question here. Are the kits simply built by the volunteers? How does that work?
Are the what?
Are the kits built by the volunteers, or do they send in the individual materials? How does that work?
The kit, well, either way, but usually the kits are built by the volunteers. Like they get the plastic bags, and then, you know, now with COVID, it's harder to do, but it used to be you get a big group and you have a bunch of toothpaste and toothbrushes and dental floss, and you all put them together, and then they deliver them to us in a box, all pre-made. But we'll take it anyway. If someone wants to just give us the supplies and we have volunteers put them together, we can do that too.
Okay. And what's a best practice for the bag? Are we talking like a gallon-size Ziploc bag, or?
They're usually a gallon size.
Perfect. Thank you, KD. So Allison has a quick question here. She says, outside of adapting a telehealth model, what other operational or programmatic functions have you adapted that may continue with your organization as we enter into whatever this new normal looks like?
Well, telehealth is probably the most important. You know, our nurses will also follow up by phone and text with patients. But telehealth is really it. And I didn't say this. One of the silver linings of telehealth is that our no-show has reduced by 60%. Just patients who couldn't get here for various reasons, they can do telehealth. So that's another reason why we're seeing way more appointments than ever before.
Mm-hmm. Do you think, will you guys keep any of these functions moving forward?
Yes, we will definitely continue with telehealth. It'll always be part of what we will offer for those patients who can't get here to see the doctor. And we are already planning a large drive-through flu vaccine for this fall for our patients.
That's wonderful.
And we had COVID testing here. We partner with so many people. Rex Hospital brought their mobile unit. The zip code where we're located has the highest number of confirmed COVID cases. So they know this community is in need. And so Rex brought their mobile unit and parked in our parking lot. And we had over 200 COVID testings for people in our community.
That's huge.
About a few weeks ago.
That's huge. You know, one of the things that we all know about, but I think we still need to get really to the core of, are the disparities in cases and deaths in minority communities as a result of COVID-19. And it's interesting, United Way has been exploring this topic with several community leaders in death and have plans to publish a story, but it's incredibly important that tests are available to people where they are, that organizations and companies can adapt to meet people where the need is and not force folks to adapt to, you know, the organization or the company needs. So to hear you guys having the foresight to establish all of those, even as far back, those protocols as far back as the fall, is incredible.
Right. Well, I definitely think we've been aware of the disparities in health for a while. But in another silver lining of COVID, it's heightened that awareness and made people more aware of it.
Mm-hmm. Absolutely. So we've got a comment and a question. So Joe on the United Way team says, we happen to have a lot of extra gallon Ziploc bags, dozens of full boxes. So if you would like some, let us know.
All right. Yeah.
And we'd be happy to provide those.
Okay.
And then Jeff has a question. He says, what strengths have you seen in your nonprofit and or those who serve during COVID? And what has been the surprising positive reveal from this pandemic, if anything?
Oh, wow. Well, I mean, I think community is important and we all know that, and we all need to work together, and we couldn't do what we do without our partners. And, you know, we have a lot of nonprofit partners and also a lot of donors and every corporations and foundations and congregations that support us. And we couldn't do it without our community. And this is a very generous community, I think. You know, I think the surprising thing for us is how quickly we did pivot to telehealth and how successful it was. I mean, you know, we weren't sure our patients would, you know, be open to something so different and so new, and they have.
Mm-hmm. Speaking of generous community, we have David Bohm with us from Campbell Law, and he shared that he has partnered with, his team has partnered with Alliance Medical Ministry to provide free legal services to your patients. And he's wondering what other key community partnerships already exist with Alliance Medical Ministry to help deliver critical services, and what key partnerships should be formed with your organization to help serve and deliver critical services.
Oh, wow. So we have a full-time social worker in our behavioral health department, and he's embedded in the clinic. And the great thing about having a social worker is he screens our patients for all other needs. He screens for domestic violence, he screens for food insecurity, transportation needs, housing needs, employment needs. And then we have a really close relationship. In fact, United Way helps supports this collaborative with Step Up Ministry, with Catholic Parish Outreach, with Dress for Success. We have a great relationship with Interact. So yeah, I think all of Interfaith Food Shuttle, they helped start our garden. The partners are really important in helping make sure all our patients get everything that they need, not just the medical support.
Mm-hmm. And for those who
Did I
aren't,
answer that question?
I think you did. If I think the one question in there too is, are there any key partnerships that you feel like are missing? Is there any way the community can help, make those connections for you guys?
Well, I can't think of anything specific, other than we always look for volunteer medical providers. And that's a very specialty type need. But it's really important if we find a reliable, meaning someone who can come regularly. For instance, we have a psychiatrist that comes every Wednesday. We have a physical therapist that comes every 2 weeks. We have a cardiologist that comes once a week. We have OBGYN. We have a really high need for OBGYN volunteers. So I would say needing specialists in the medical field to volunteer here is always a need.
Got it. That's helpful.
Because it just means our patients don't have to go someplace else. They can get all that they need here.
Yep. And I do want to point out for those listening in that the organizations that Melanie mentioned that they have partnerships with are also organizations that United Way funds. So it's an incredible example, not just of funding organizations like United Way being very strategic in the funding decisions to have the biggest impact, but also of organizations supporting each other for a stronger impact. It is a complete 360-degree approach. I come from Los Angeles for the last 6 years, and I got to tell you, I feel like the Triangle is ahead of its game, ahead of the game when it comes to having the biggest impact. And I'm always so impressed to hear and see about those partnerships and those efforts happening in real time, both with United Way support, but also like outside of it. You guys are just doing it, and that's amazing. One more question came in. I know you're primarily focused on uninsured working adults, but do you offer any pediatric services? Okay, got it.
Only adults.
Got it. Is there a place where working uninsured adults in Wake County who have kids can seek services for their kids that you're
I'm pretty sure Urban Ministries Clinic takes children. I think it's Advanced Medical takes Medicaid. They take children. There are a few others, but no, we only do adults, and we don't take anyone with insurance. So if someone, which is a good thing, gets a job with insurance, then they have to leave our program.
Got it. That's an important distinction. So it looks like we don't have any more questions coming in. So I just want to take time again to thank you, Melanie, for taking time out of your day.
Thank you.
Your team.
Devin, can I add one thing that I
Absolutely.
wanted to say? And that is one of our other goals is to keep our patients out of the hospitals. Our hospitals right now have a huge strain, and most people don't want to go to the hospital if they don't have to. But, our patients, once they find Alliance as their medical home, we have found that their reduction in ER, emergency room visits, and hospital admissions is reduced by like 65 to 70%.
That's incredible. Well, thank you.
Yeah.
Is there anything else that we didn't touch on that you'd like to share while we have?
No, but I think that's an important community for people in the community to know that we're also saving the community a lot of money by keeping our patients out of the hospitals.
Absolutely. It alleviates the strain, and that strain is felt more than ever now. So thank you so much. Thank you everybody who was able to join us. We have been recording. We will be sharing the recording on our social media. Melanie, I will share the file with you as well. On our social media channels, Facebook, Twitter, YouTube. We will also be sure to email it around and add it to the website. So if you guys do want to send it to your own teams at your own companies to let them know about the work that you're supporting when you donate to United Way, please do, and keep an eye out for that soon.
Yeah, well, thank y'all so much for your support. It means a lot and it's important.
Thank you, Melanie. All right, everybody, happy Friday. Enjoy your weekend, and we'll talk to you soon.